Welcome to Health Policy, Organization, and Finance. This is your week 1 video. So we're going to start out talking about cost. And a lot of students say, why do we constantly learn about the high cost of healthcare? Well, we start with the high cost of healthcare probably because it's the most discussed topic. And it really influences policy because a lot of times our policy conversations start with how do we bring down the cost of healthcare. The readings this week, both in the text and the ones that I've linked, talk about why U.S. healthcare is so expensive, and there's an interesting article about why maybe it's not that expensive. Some of the things that you should notice is that the issues explaining why we have expensive healthcare tend to overlap throughout the readings. These can include administrative costs, overuse of technology, overuse of healthcare, inequity in prices, and financial incentives in all the wrong places. So if there's such a big problem, why can't we fix it? Well, there's a couple reasons actually. The reason we can't make healthcare less expensive is because it's a really complex system, right? It involves complex economics. We have both a federal system of healthcare insurance called Medicare. We have a state insurance system called Medicaid. Each state runs that program slightly differently. We have private insurers. We have different types of insurers. So there's a lot of overlapping systems. We have state rules, federal rules, and private insurance rules. So making any real changes is very difficult. So what can we do? What we do is constantly fix the problem. Sometimes we use small fixes, sometimes we use large fixes. These changes are made by constantly revising our healthcare policies. So this week, since we're in week 1, I want you to think about what is the basic health policy cycle. We're going to start at the beginning. A lot of instructors in healthcare policy teach that health policy starts with an idea. I don't think that's correct. I think policy actually starts with a problem. Policy really starts as a reaction to a perceived issue, problem, or crisis. So a lot of policy starts on a small scale in an organization, in an agency, with an individual. Large policy is often modeled on successful small policy. You see this when a state does something really successful and then the federal government tries to implement it. So let me give you an example of where policy starts. Susan Smith, the director for the Center for Disease Control for her state, learns from annually reported data that infant vaccination rate in her state is at an all-time low. Sam Smith, medical director for the Area Free Health Clinic, has noticed there is a growing number of high school students abusing a new drug that causes long-term brain damage. This is really where the health policy cycle starts. A perceived issue. Then what happens is there's a response, and this is where policy is really formed. So an example is Susan Smith, the director of the Center for Disease Control, decides she wants all infants in the state vaccinated. Sam Smith, the medical director at the health clinic, wants to prevent high school students from abusing this new drug. How's he going to do it? So now we move into the formalization of policy. So what that might look like would be Susan Smith submits a bill to the legislature to require the vaccination of all infants born in the state. Sam Smith sends out a memo to physicians of the clinic requesting them to discuss drug use with middle school students at their annual appointment. So I think it's important to start to think about policy as starting way before it's in the legislature, way before it's being discussed on television. Policy really starts when there's a problem. So I've created this little diagram just to show you how to think about policy. As we start this course, I just want you to think about where all of this begins. It doesn't usually begin on the floor of the legislature. So now that you see the basic structure of policy, we can start to think about policy analysis, which is going to be the biggest part of this course. Throughout the course, I'm going to give you some tools to analyze and evaluate policy. My list is not exhaustive. You don't have to use my list. However, I want you to think about what these policy analysis tools are and why we use them. In your career, you might come up with your own tools, and that's fine. I'm giving you these tools just to use within this course. So we're going to start with 3 tools to analyze health policy: cost, quality, and access. You have probably heard those terms before. What I want you to do is think about, when we talk about a health policy, what are the costs, how does it affect quality, and how does it affect access? Those 3 tools alone will really help you analyze policy well. A lot of times I ask you, either in a discussion post or in your paper, is this a good policy? Well, good policy is very subjective, and I'm not saying that there is a right answer to that question. However, when you see that term good policy, what I'm asking for is you to use your tools that you've learned. You can also use personal or organizational perceptions. You can use politics, ethics, fairness. But what I'm asking you to do is talk about whether something is good policy based on your tools or any other determination based on your own criteria. But I want you to be consistent. So the tools this semester give you a criteria to use to dissect policy. There is no right or wrong answer, though. So let's go back to our examples from before. Susan Smith, the director for the Center for Disease Control, submitted a bill to the legislature to require the vaccination of all infants born in the state. Susan asked you, in your expertise as a health policy student, if you think this is good policy. You can help Susan by using our tools, right? What is the cost to do this? So when you're breaking down Susan Smith's bill, you're going to think about, well, how much does it cost for this bill to work? Is there a cost to vaccinations? Is there a cost to the education? Is there a cost to actually putting it through the legislature and getting it passed? What about quality care? Is vaccinations for all infants going to provide quality care? Well, probably, but we have to dissect that. Why? And then access. Who does this give access to? Well, this is actually a great example of high access policy, right? Should be vaccinations for everyone, so you know that this has really good access. Some policies might have really low access. In terms of Sam Smith, the medical director at the health clinic, he sends out a memo to all the physicians in his clinic requesting them to discuss drug use with middle school students at their annual appointment. Sam asked you, in your expertise, if you think this is good policy. So looking at our tools, is this good policy? Well, what's the cost to do this? It takes up physician time. It includes probably putting things in the medical record, so that's other providers' time in the office. Does it provide quality care? Well, that's a harder one, right? Is the discussions with the students going to create an impact? We don't know, probably at this point. And then access. Who has access to this education? Well, some immediate questions might be, well, how many students does this clinic serve? Do they serve a lot? Do they serve a couple? Can they serve broader array of students? Can they go into schools? Right now, it looks like maybe this won't serve a lot of students because it's just the middle school students that would attend this clinic. So those are 3 examples of how you can use the tools of cost, quality, and access to look at policy. So getting started with policy analysis is easy. You're going to work on this throughout the course. So if you feel like that was confusing, don't worry, it'll get easier. You're going to use your tools in the week 1 discussion post this week. So for your original post this week, you're going to come up with a policy to reduce the cost of healthcare. This can be your own idea or an existing one. Make sure to keep it simple. Don't think of a really complex policy. In your response post, you're going to analyze another student's policy using your new tools. Just a few comments on finance and organization. Healthcare costs something. Public health costs something. But health policy also costs something, and I think a lot of public health providers forget that. So where finance is really wrapped into this course is not only do policies cost something to consumers, to providers, to the system, but getting health policy off the ground costs something as well, and we're going to see that throughout the course. Keep in mind that those who are doing health policy are paid. Implementing, executing, and evaluating policy costs something. So when we constantly change health policy, we're paying for that too. So that's it for week 1. I don't want to get too in depth. As always, please let me know if you have questions, comments, or concerns. I am happy to set up individual appointments with students, but you can always call, text, email me if you have questions. Thanks so much and enjoy your week 1.